So today I just wanted to talk a little bit about the new updated screening guidelines for breast cancer that came out last week from the USPSTF, the United States Preventive Services Task Force. They updated their screening to recommend starting at the age of 40 and to be screened every other year up through age 74. And prior to this, their recommendation was to start screening at 50. There are other organizations out there that have different screening recommendations. For example, ACOG, which is the American College of OBGYN, they recommend starting at age 40 and going every 1 to 2 years. And why does any of this matter? Well, it matters for a couple of reasons. Number one, it determines insurance coverage and also helps guide doctors and other providers in terms of what we should be routinely ordering for our patients. And some of the reasons for this update are that they're seeing younger women in their 40s being diagnosed with breast cancer at increasing rates. And this can also be more aggressive form of cancer if diagnosed at a younger age. And if you're not getting the screening done, then you can miss something that could be potentially curable. And even more among Black women, they're seeing higher rates. So definitely something that needed to be addressed. And also, the reason that there's even a question of when you should start getting screening is that, well, sometimes you could get, especially in younger patients, you can get what's called a false positive report. Younger patients tend to have a denser breast tissue, and so it can be harder to maybe read the mammogram. So some things might require further workup, whether that's more imaging or even a biopsy, for something that might have turned out to be nothing, but because you see it now, you kind of have to pursue it. So you kind of have to weigh the risks versus benefits of doing more screening versus unnecessary testing. But I do think that this is a move in the right direction to have more organizations on the same page as far as when to start screening, and hopefully, keep on keeping on and keep women healthy.